Good morning, everybody, and welcome back to AL.com's COVID-19 Town Hall series presented by AARP of Alabama. In this five-part series, we're bringing you an expert panel each week to talk about a topic that coronavirus has impacted in our daily lives. Today, we're focusing on politics. I am joined today by Governor Kay Ivey, by Alabama Minority House Leader Anthony Daniels, Representative Anthony Daniels, and we are going to be joined in a few minutes by U.S. Senator Tommy Tuberville as well. So we are going to get into some audience questions. We've got a lot of really good questions for each of you and for Senator Tuberville. But in the meantime, I want to take just a second, Governor and Representative, to ask you kind of how things are going in terms of COVID and in terms of vaccination rates. We know Alabama is lagging behind a lot of the country on vaccination rates. And we also have reporting that shows that for the first time since the winter surge of COVID, Alabama is now reporting more than 100 COVID-19 deaths per day. Governor, I will start with you.
Well, things are improving, but first of all, I want to thank you and AL.com for hosting this forum with Representative Daniels and soon to join us, Senator Tuberville. Thank you so much. I also want to thank the 2 million Alabamians who have rolled up their sleeves and taken the shot, and they've done it without a mandate from Washington or Montgomery. So we're doing better. Business is picking up. More people are deciding to get the shot. And let's all just continue to be good resources for our family and our friends and neighbors. Because goodness knows, I took the vaccine and it was painless and didn't hurt a bit and didn't have a sore shoulder. So I just encourage everybody to step up to the plate, roll up your sleeve and get the shot.
Well, and Representative Daniels, I'm going to give you the mic in just a second. But first, I want to add something, and I forgot to mention at the top. But as we have had in this series before, we have a medical professional, that is Dr. Molly Fleece from UAB Medicine. She is also part of our expert panel. Now, you don't see her on camera. That's because she's hanging out off camera to answer your medical questions in the comments here. So if you have a medical question, like how long do I need to wait to get vaccinated after getting COVID-19? If you have questions about monoclonal antibodies, or who is eligible to receive those, drop them in the comments here. And Dr. Fleece, who is an expert in infectious diseases at UAB, she will answer those questions for you. So my apologies on missing that part. Representative, you go ahead.
Well, thank you for having us. Also, AL.com for continuing to educate and be informative for the citizens in the state of Alabama. And thank you, Governor, for your leadership and your willingness to just grab the bull by the horn and addressing this issue. I would say that, we're very fortunate to have 78% of Alabamians over the age of 65 that's fully vaccinated. And so while there are a lot of reports about the lack of vaccinations throughout the state of Alabama, we must acknowledge those individuals that have decided to take it upon themselves to get vaccinated. I think one of the issues that I've seen is when talking to some of my military friends, they mentioned to me, why is it so difficult for people to get vaccinated? We've never asked any question. All the vaccinations that we received, whether it's the anthrax, anti-anthrax vaccination or what have you, we weren't really given a choice. And so we're still here, we're still standing. And so I think that there's a fear out there, but I would tell you that there are more optimism, more leaders like state leaders and local leaders that are speaking positively about getting vaccinated and wanting to get Alabama back going again and getting our economy back as strong as it was before.
Well, and we know that Representative and Governor and Senator Tuberville, who again will be joining us here in a few minutes, we know that each of you have been very vocal about vaccines and encouraging vaccines. Now, again, we're going to get into some of these questions in a minute, but first, I want to ask you both about something that has really, I think, hindered the process of COVID, of vaccines throughout the last year and a half, and that is misinformation. We know that there has been rampant misinformation, particularly on social media, concerning coronavirus and vaccines. Governor, how have you handled that misinformation? And what do you say to people who maybe don't know where to get credible and factual information?
Well, I'll refer you also to my op-ed article I did for the Washington Post about folks who are putting out misinformation and confusing people with fake news and pushing conspiracy theories, that's just not helpful at all. In fact, they're actually lying to unvaccinated folks, which is just a pure, that's just so sad. But the information is accurate. And if you have a concern about whether or not you should get the shot, for goodness sake, talk to your doctor. They know you better than anybody else and your health needs, and see what they say and follow their lead. But goodness knows everybody needs to take the shot. It's working, it's effective. The data proves that it's effective and working. And also, I want to again ask the medical doctor about their view on the news that Pfizer may be putting out a vaccine for children that are 5 to 11 years of age, and get that doctor's opinion to help our parents make that decision as well.
Absolutely. Dr. Fleece, we would love to hear your opinions on that possibility of the Pfizer vaccine. I believe that UAB actually had a press conference the other day saying that could be available even by Halloween for children 5 to 11. And that again is some big news there in the COVID and in the vaccine world. So Representative Daniels, I know that you have small children. What do you think when you hear that news that the governor just brought up, saying that there could be a vaccine for young kids pretty soon?
Well, until we hear it rapidly from the healthcare professionals and those that have been in the industry for some time, we're going to, take that information and report it back to our district. I, for one, as having a wife that is in the healthcare field, if that's an option for our child, our 5-year-old, that's something that we're willing to do as long as the data and the science backs it up.
Well, and we are now joined by Senator Tuberville. Senator Tuberville, welcome. We are glad to have you. And I just have gotten into some questions here, but I want to give you the opportunity that I gave to Representative Daniels and Governor Ivey, and that is to just kind of give us a brief thought where you think we're standing on COVID right now and in vaccinations. And then as well, we'll get into some other questions for you. I do believe also too that you are muted here, and we've all been through this this virtual meeting life. So if you want to unmute yourself before you start talking as well. Let's see. I think we are waiting just on the senator to get unmuted here. I will keep that monitored here, and when he gets his mic working, then we will add him back in here. But in the meantime, let's just keep going with some of our questions. And one I have for you, Governor, and that is: do you feel that a vaccine mandate would get the state closer to where we need to be in terms of vaccination rates? And if so, then why do you oppose that?
Certainly opposed any kind of government mandate for vaccinations. I signed the vaccine ban bill. We don't need government telling us how to manage our own health. And more people are stepping up and volunteering to do it. And it's the right thing to do, to step up and get your shot, because it's effective, it's safe, it's free, it's available to everyone. And it's just the right thing to do.
And again, I'm sorry, I'm sitting here trying to message with the senator's campaign, get them back on here. But I know again that you oppose that mandate and you have made that clear. How do you think that we get people to the level where they need to be on vaccination rates if we're not going to impose any type of mandate?
We keep encouraging them to do. That's what I say. Let's all be good resources to our family and our neighbors and our friends, and encourage them to take the vaccine and assure them that it's safe and effective and painless. My shot didn't hurt a bit, didn't even get a sore arm. So it's easy to do, it's quick, and it's effective. And the science proves that it works and prevents this virus. So it's just the easy, right thing to do, just to use common sense and roll up your sleeve and get the shot.
Mm-hmm. Now, Senator, I believe we've got you back here. So welcome again to our COVID-19 town hall. It's good to have you here. And first, I just want to have a quick talk with you and just get your opinions on where we are right now with COVID-19 and with vaccinations in Alabama.
Well, I'm on the health committee here in Washington, D.C. Been on for, I guess, 9 months now, and had chance to be in all the hearings and listen to all the so-called scientists. And, we've really not gotten a lot of information that has been consistent. That's what I've been disappointed with. We've had so many things about masks, about vaccines, about things you can do, can't do. There wasn't a lot of therapeutics out there early for us. Everybody think, if you get COVID, you just got it. But there was no avenue of getting over it other than going to the hospital. So I think we've made some progress. The vaccine, for instance, does it help? I think it helps. I took it. My family took it. Everybody on my staff has taken it. Nobody was forced to. I don't believe that it should be mandated. I think you should have your own choice. It's a free country. But I think you should be educated with it. Just listening to Dr. Fauci and the CDC director, Walensky, talking over the last, I guess, about 6 months, there's been so much confusion of what to do, what not to do. Now we're into the boosters. Booster shot. Do we take a booster shot? Does the one that I took 9 months ago and Governor Ivey took 9 months ago and probably Minority Leader took months ago, is it going to wear out? Do we need to take a booster? But you got to take your hat off to President Trump's administration, because what they got it in so quick a time. It wasn't approved by the FDA until just a few months ago, but I truly believe it has saved people's lives. It's kept them out of the hospital. You might get it if you take the vaccine, but it's been proven that you don't get near as sick. So I think it saved lives. But again, as y'all were talking about, and Governor Ivey just said, hey, it's your life. You get to make that decision, but make an educated one.
Well, and Senator, we know that unfortunately, whether most of us like it or not, many things about coronavirus and about the vaccines have become political, or people view them through a political lens. Now, you mentioned these vaccines were developed under then President Trump, and you did mention that you were vaccinated as well. So, Senator, if somebody comes up to you, maybe in a grocery store or while you're walking on the Hill, or whether you're watching an Auburn game, and they say, look, we don't trust the vaccine. Why did you get it, and why should I get it? What would you tell that person?
Well, we have what we call a physician here in the Capitol that we have an opportunity to go to. I went to him. I talked to him about it. We did research, but again, having the opportunity to listen to the people that were around developing this vaccine, had the opportunity to get an educated lesson on it, basically. And we thought about it. You're around so many people like we are as in public service. You got to really be careful. Number one, you getting it. Number two, you spreading it to other people. So I think you should not just think of yourself, but think of other people when it comes to this vaccine. Again, educated decision. Once you do that, make a decision and live with it, because I've had some friends now in Alabama that decided they didn't want to take it. And unfortunately, they're no longer with us. Now, would that have happened with it? It could have, but who knows? So just make an educated decision.
Representative Daniels, can you share why you personally decided to receive the COVID vaccine?
Well, back in December, I contracted COVID-19 on Christmas Eve, where I was unable to be with my children on Christmas Day. And I had a very tough time. A 38-year-old that works out 4 days a week couldn't even lift a paper bag. And so it was very difficult for me. I actually had to go to UAB and receive the monoclonal injection, which I believe really saved me. And so it was at that particular point that I was very convinced, because the monoclonal just really eliminated all of the symptoms within 48 hours. And so from the fever, I was 5 to 6 days with a fever of 103 and feeling really bad, lost a lot of weight. And so I'm a living testament that the monoclonal antibodies infusion really eliminated my symptoms. And so for me at that point, I was very convinced. I know that there's a lot of apathy out there and a lot of misinformation that's out there online. But, there's so many lives that have been lost as a result of contracting COVID-19. And so you can't take a chance on it. And I would rather be protected against something that's going to work to really defeat this virus, as opposed to just going in and not having any type of protections.
Well, and we know that Alabama State Health Officer Dr. Scott Harris has been he's been very vocal throughout 2020 and 2021 about everything he knew regarding COVID, the virus itself, regarding vaccines, and recently about monoclonal antibody treatment. He has been very outspoken and really been getting the message out there. So, Governor, my next question to you is, number one, are you proud of how Dr. Scott Harris has handled everything throughout this pandemic? And number two, you've had to make some very tough decisions, and I'm sure that you are continuing to have to make those decisions. Has his opinion influenced you in that decision-making process?
But if there's been any silver lining in this whole COVID-19 pandemic, it is Dr. Scott Harris. He has a background in infectious disease. He's very available, very willing to give his opinions and his medical background and advice. And he's easy to work with, and he loves the people of the state of Alabama. He's a man of compassion. And he's a joy to work with, and I just value his opinion and what he says. And in fact, he and I got the COVID shot together the very first time. Then I went out and had a press conference. So Dr. Scott Harris is a real superstar.
And Senator, have you had a chance to watch any of Dr. Harris's press conferences or keep up with Dr. Harris? I know that you are up in DC, and I know that you said that you have a doctor on the Hill, but I'd be interested to know if you've kept up with him.
Yeah, I saw some early, when we're having really big problems. I haven't seen any lately. We're in committee meetings up here trying to do our due diligence on this end, but I've heard good things about Doctor, and again, I've heard from doctors all over the state, especially since this new variant hit about, I guess, a month and a half ago or so. And a lot of them calling about the monoclonal antibodies and all those things. But he's been on top of it. And I think Alabama is very fortunate to have somebody with his experience in infectious diseases. And it's not a guess, it's a science. And I think he's done a good job.
You make an interesting comment there, Senator, and by saying it's not a guess, it is a science. So we were speaking about this earlier about credible information and how there are, unfortunately, many people who see things that are not true online and believe it and take that as news. So how do you recommend that people get to the science, as you said, not take the guesses, but get credible science and credible information to make their decisions with?
Well, talk to people that are educated about what's going on. There's so much disinformation in social media, so much disinformation, and you want to make sure that you get the right information. Again, go to the people that you trust, that that you can understand. They know who you are. They understand your problems of the past medically, and also go to your preacher. People that understand, have known you for a while. I think it's important that you're around people that you trust, not only on the scientific side, but also the religious side. This is serious. A lot of people are dying, and it's not going to stop. This virus is going to be with us for a while. We're going to have different variants, and probably, may not happen, but probably you're going to be exposed to it at some point, whether you have been, whether you will be in the future, whether you get sick, don't get sick, you're probably going to be exposed to it. So that's the reason you need to make an educated decision. You cannot run from this virus. You're not going to get away from it. Mask probably help to some degree, but not a whole lot. And it's just important that we're prepared for what's coming, because this thing hasn't gone anywhere. It's just gotten worse.
Representative Daniels, what have you heard the most from your constituents about their concerns about coronavirus and the vaccines?
Well, a lot of my constituents seem to be on board with the vaccine. There are some that still referencing back to the Tuskegee Project, and they're concerned about that. And I assured them that, look, this is not something that you should be afraid of. We've seen so many lives lost, and this is something that's going to prevent the impact of the tremendous impact or fatality of COVID-19. No, it's not 100%, but as the senator mentioned, this is something to help reduce the impact of this virus. In Alabama, we have huge underlying chronic illnesses throughout the state of Alabama. And so for those individuals that have those chronic illnesses, this virus it actually feeds on that. And so I think that a lot of the fatalities that we've been seeing across the country, not just in the state of Alabama, a lot of times there have been some underlying health conditions, whether it's obesity or diabetes or heart disease. So I think we got to be very careful in making certain that we're protecting ourselves, but not only ourselves, we're protecting our families. For me, I did it not just for me and my family, but I did it for my parents and my wife's parents. And so to make certain that we're able to congregate as a family and feel safe.
Governor, we talked earlier on about all of the tough calls you've had to make through 2020 and 2021. What do you wish that people knew went into leading during a pandemic? Again, this is something that unfortunately has become very political now. Even on this town hall, we've got people from both sides of the aisle here that are pretty much giving the same message. So what do you wish that people knew about being in your position right now?
Well, I don't know. There certainly was no playbook available for any of us to go by. And so we had to do the best we could given the information we had at the time. But the good news is now we have a known effective tool at our fingertips that if we'll just take the vaccine, we can put this thing behind us. That has not always been the case. And over a year ago, we all were praying for a miracle. And then the Operation Warp Speed came about and got the vaccine. And I took it straight up and encouraged everybody since then and have continued to encourage people to get the vaccine because it's effective, it's safe, it's painless, it works, and it's just the right thing to do to protect yourself and your fellow man.
Well, and Senator, you were elected in the middle of a pandemic, elected to federal office, and you actually had won that election before the vaccines came available, right before. So I can imagine that was a very interesting time to assume public office. And kind of same question to you. What do you wish that people knew about taking on office and leading through a pandemic?
Well, going back to your first point about campaigning, it did. It right in the middle of the campaign, we just finished the primary, and then we were getting ready to have a runoff, and then we had to extend it for 4 months because of COVID. But it was an interesting time going around and seeing people and talking to them about their experiences. And we really, as the governor said, we had no clue. The playbook, there was no playbook, and it's still not there. We got to depend on people that know a lot about this, but it's an interesting time that I think, and the minority leader just brought this up, interesting time that we probably need to sit back and really understand our health. If you don't have your health, you don't have anything. And he brought up the nutrition part, people overweight. I think this is the time that we all can really check to make sure that we're healthy. We have exams periodically. We watch what we eat because a lot of it has to do with that. And you're seeing a lot of people that are just not very good physical shape because of they don't watch their nutrition. So there's a lot of things that go on with this. But being in a campaign, it was hard enough as it was. But being in the middle of a pandemic and not knowing what to expect even made it harder. But things are not going to get any easier for all of us because, as I said, this thing's not going anywhere. We've got to fight back against the virus. We personally get back to work, get back to school, and get the vaccine. I think that's the three things that we've got to get this country going again, and takes all those to make it happen.
Representative Daniels, the senator just mentions, look, this unfortunately going to be here a while, this virus, and we've got to get past it. He mentioned a few things, including getting vaccinated to get over this kind of hump and get back to, I guess, what we're all calling the new normal, even though we all collectively hate that phrase. Representative, how do we do that? And how do we get past this hump of people being so divided about this issue?
Well, I think one of the things that we have to do is a better job educating the public on the impact. Because you got all this misinformation out there, we have to counter that with the correct information. We got to use credible sources, the CDC, the Department of Public Health, and our physicians all across the state of Alabama. And so I think we have to have a consistent message. I think that local lawmakers local municipal office holders, statewide office holders, all of us have to come together and start educating our constituents. Yeah, there's going to be pushback, but I think that the important part to really defeating the common enemy in COVID-19 is educating the public. I think that we got to educate the public on the new variant. We were educated for months and months and months that the alpha variant, you've been around someone for 15 minutes or more, or 6 feet social distancing. Well, the new variant, the Delta variant, you can transmit the virus in seconds. And so I think that there's a lot of things that we have to do, because this new variant is much more infectious than the alpha variant. And I think that we got to educate the public on how fast you can contract this virus, the new variant. And so I think education, everyone being on the same page, and really being a team effort to educate the community and push back on any misinformation and direct people to credible sources.
Governor Kay Ivey, Senator Tommy Tuberville, and Alabama House Minority Leader Representative Anthony Daniels. Thank you all so much for your time today, coming together to answer these questions on both sides of the aisle and kind of bring everybody to the middle, as you said, Representative, and really make this a team effort to get past it. I appreciate you and your time so much. Everybody, thank you for joining again our AL.com COVID-19 Town Hall series presented by AARP of Alabama. Be sure to join us next Wednesday at 11 a.m. for the 4th show in our series, where we'll focus on faith. Have a good day.